So, I've said, what about this reality? We've seen the rhetoric, what about the reality? In a review of the National Health Service commissioned by Lord Darcy, when he was, for a brief while, the Junior Minister of Health, one study that he commissioned described the NHS, and you'll be familiar with this, as consisting of islands of excellence in a sea of mediocrity. Now, this was a somewhat sanguine assessment, and it probably describes the current state of affairs in terms of the engagement of patients, as much as it describes the general state and the overall quality of the performance of the NHS as a whole. There are surgeries, clinics, even hospitals, where patients are genuinely engaged and empowered. We shouldn't forget this when we complain about failings. We shouldn't forget it. We should celebrate it. And we should do something which the NHS is particularly poor at doing, namely share it as a good example of good practice, so we can learn more widely. I used to say in the Healthcare Commission, if we found something that worked, we should get all the managers in the local area and put them on a bus and take them to wherever it was, Hull or Widnes or whatever, so we can find out what it is, what's the magic that they've got that we currently don't seem to have. Wasn't regularly embraced as a concept. So there are places that do very well, but we also need to recognize this sea of mediocrity. And in addition, the continuing diet of scandals which feature in the media. Currently it's nursing homes and the care of the elderly again. And I'm sure, as I speak, that there's a hospital somewhere which is not providing the safe and humane care that patients are entitled to expect. Phil will remember I said that at the press conference after the report on Bristol, where I was asked, can I hand on heart guarantee that there is, after Bristol and all that it threw up, there was no hospital in the country where patients were put at risk. And I said that no, I couldn't guarantee that for one moment. And sadly, events have proved that to be the case. We all know the litany of disasters that can be described. So, there is this mediocrity, there is the diet of scandals, and they tend to be about hospitals. Meanwhile, there's also the unknown number of surgeries where GPs go about their quiet business, failing to diagnose this or that, misdiagnosing it, or diagnosing it too late, while the patient is assured that he or she is in good hands and currently can't know any better. So, the report on where we are, in reality, is mixed. The rhetoric is getting there. Patients are important, patients have rights. To some, patients should even be in the cavalry leading the charge. The reality lagging behind, and in some cases, and some places, the reality is really bad. Some places, it's really good. So you say, what's new? NHS has always been like this. And we get exposed to metaphors like, give us a break, it's like turning a tank around in the channel. How many times have we heard this? It's a very difficult process to change. Well, come on, it's over 60 years since the NHS was founded. And isn't it a time where we didn't settle for mediocrity with bits of excellence and bits of disaster? Obviously the answer is we shouldn't. And that's been the call from politicians and policymakers for some long time. And we've listened to their denunciations, and we're all familiar with the political cry, something must be done about it. whatever this or that is at the time. And we've seen changes come thick and fast. Yet. So, why haven't things got better for patients to the extent that they deserve? Why, despite the myriad of changes that we've been exposed to, has mediocrity remained the general order of the day? Bearing in mind that report to Lord Darcy was, 3 years ago? So, I've asked a question. The rhetoric, the reality, why is it still the case? Well, we've all got our ideas and we've all got the answer. All of you know the answer, I guess. And one of the answers is what prompts my standing here and what that refers to, namely the greater empowerment of patients. The argument is that things would get better if patients were more effectively involved in their care and more empowered. And I'm sure in some contexts there's probably some truth in this. I'm one of those who advocates patients should be involved. It's of course less true when you're dealing with children and young people who may not be able to be involved and who are not always surrounded by a concerned and loving family. I used to be a specialist in medical ethics, and I remember being referred many times by particularly young doctors to what they call the golden rule, that if you can do it to somebody else if you would do it to your own parents or your own wife. I've known enough people who would do things to their own parents and wives that I wouldn't imagine doing, that I don't think that should be the golden rule. And not all kids and young people are surrounded by loving, caring families. And equally, the idea of empowering and involvement it's less true as a proposition as regards those whom we push to the margins of our society. And we then call them vulnerable. Notice to me the importance of language here. People aren't vulnerable. It is we who make them so by failing to provide the support that any civilized society should provide. Categorizing them as vulnerable puts them in a capsule, gives them diagnostic description, enabling us to treat them differently. We've already treated them differently, so this is a double whammy. So empowerment of patients with those provisos, children and young person, others at the margins, is one proposed solution. That'll make it right. And there are many such solutions. What do I say? Well, I say I don't have a solution. So the rest of this particular lecture will be, as it were, a footnote to that proposition. Indeed, I think the pursuit of a solution is itself the problem. The idea that there's one key thing that'll do the trick, that's part of the problem to me. So what I'm going to offer you in the next 2.5 hours is some analysis. You laugh. The doors are locked, I tell you. I'm going to offer you some analysis and some suggestions of what might help for the future. And I'll weave into that some notion of where patients stick in this overall view of things. I've no real expectation that anything I might say will change anything, but one perseveres. Maria's right, there were 196, 98 recommendations, 189 were accepted by Her Majesty's government, and here we are. So, I said I'd give you analysis and then I'd give you some suggestions. The analysis. For about, many of you are not old enough to realize this, I'm very old. For the first 25 years or so, the NHS moved along relatively gently. It was the territory of doctors, matrons, and grateful patients. That was it. My father would tug his forelock at whomever dispensed whatever it was thought appropriate for him. That was the order of the world. Since then, after that gentle period that we think of, remember that famous cartoon in the New Yorker of two guys sitting at a bar and one turns to the other and says, "Don't you realize, Gus, we're living in a golden age?" Sorry, you have to live through it to really, it's a joke, it doesn't matter. So there was that gentle period. And then, since then, NHS has been in what you might describe as a state of permanent flux. That's F-E-L-U-X. With change following change with quite dizzying pace. All the changes, of course, as they appeared, were going to be the change. The change that would really change things. But if you know your Lampedusa novel, All the Leopard, you will know the famous quote from the Prince when he says that everything must change so that everything can stay the same. Very little, in fact, actually changed on the ground for patients and their experience, despite the maelstrom of change.